Good afternoon, everyone. My name is Bronwyn Starr. I am a Senior Program Officer with the New York Health Foundation. Thank you for joining us for our webinar, Building Healthy Communities, a Look Back. I had the privilege of helping to oversee our Building Healthy Communities priority area from 2015 through the end of 2020. New York Health invested more than $20 million in building healthy communities in those 6 years. Building Healthy Communities was a place-based initiative. The Urban Institute describes place-based initiatives as programs that aim to improve the quality of life and access to opportunity for people, particularly people of color and families with low incomes who live in neighborhood cities and rural communities experiencing disinvestment. I'm going to share an infographic on some of the accomplishments of building healthy communities as I walk you through them briefly. First of all, New York Health Foundation was motivated to invest in place-based initiatives in response to the growing body of evidence that our zip code has a greater impact on our health than our genetic code, which sounds a little cliche now, but I think continues to ring very true. The foundation focused on improving access to healthy, affordable foods, safe places, for physical activity and community engagement in 6 neighborhoods throughout New York State. Clinton County in the North Country, Brownsville, Brooklyn, East Harlem and Manhattan, the near west side of Syracuse, the near end of Niagara Falls, north end Niagara Falls, excuse me, Brian, and the lower east side of Manhattan. We also partnered with New York Community Trust, who invested in similar initiatives in 3 sites in the Bronx. Together, these initiatives we called the Healthy Neighborhoods Initiative. Our first investments were to community convener organizations in each neighborhood to lead this work. Our initiative supported more than 100 new access points to healthy food, programming in 80 spaces across the state, and leveraged over $180 million in additional funding. This was a big investment for New York Health, and as part of the initiative, we wanted to make sure that there was a rigorous evaluation of the program, both to inform the communities as well as to inform philanthropy and other place-based stakeholders. So New York Health awarded grants to NYU School of Medicine to help evaluate the impact of our investments and partnerships within the communities that we supported. The report, which is going on our website, and I'll drop it in the chat momentarily, analyzes how changes were initiated in healthy, affordable food access, access to safe physical activity, community and resident engagement, and collaboration and coalition building. We also awarded a grant to Rockefeller Philanthropy Advisors to assess how we designed and implemented the Building Healthy Communities priority area and to share findings and lessons for the philanthropic sector to draw on. Again, both reports are on our website. And finally, we also have case studies on our website that are a little more in-depth, self-reported look at the projects and the outcomes in the 6 neighborhoods. So with that, today, I would like to introduce our 4 stakeholders, our 4 place-based participants who are part of Building Healthy Communities first, and then there will be an opportunity for question and answers from the audience. But first, Brian Archie, he is the chair of Create a Healthier Niagara Falls Collaborative. Brian and his team were the community conveners organization in Niagara Falls. We'll also hear from Phil Bors, who's a senior project director at Healthy Places by Design. Phil led a team of technical assistance providers for our grantees and organized the Learning Collaborative, which you'll hear more about shortly. And finally, from NYU School of Medicine, Dr. Carolyn Berry, who is a professor and researcher in the Department of Population Health, and Dr. Beth Weitzman, professor of health and public policy at NYU's Steinhardt School. Okay, so Brian, you're going to kick this off for us and give us your overview and insights into your participation in building healthy communities.
Well, cool. Thank you for allowing me to be here today. Again, my name's Brian Archie, and I am the integrator with Create a Healthier Niagara Falls Collaborative. Been with the organization for a little over 8 years now. And it is, again, as a direct result of some work and conversations with the New York State Health Foundation that we were able to really launch. So what was it like, right? You know, I came into a group that had began to form and do some work around the social determinants of health in our city, specifically the north end of Niagara Falls. as I was invited to these meetings, it was really eye-opening for me to identify that I was living in a place of high poverty, and that was a food desert, and had dilapidated housing. And, you know, some might say, like, how is that, right? Because you live there. But I look at it as my community, and I don't see some of the other things that maybe the statistics and numbers would show to folks. And so in these meetings would be heads of organizations and things like that, really talking about what they were going to do in these spaces that they didn't really live and thrive in. The collaborative looked to maybe turn that model on its head and really start to organize with people within the community to really build that power base and help folks to learn some skills that would empower us as individuals and then bring us to a space of like collective forward motion. With that, we had opportunity over the time of our grant cycle to participate in many community convenings with other neighborhoods, specifically Syracuse and down in New York City, really to identify what strategies those folks were using to build people power and make change, and kind of bring those back and, as best we could, make them our own here in Niagara Falls. So what was our job and what was our focus? Food access. So we've worked a lot on bringing some healthy corner store initiatives around, and uplifting community gardening as a means of providing access for ourselves in terms of what we'd like to eat, you know, within our communities. Here in Niagara Falls, we don't have many grocery stores, many that are affordable, or many that have people that have access to these spaces. How do we fix that? We bring gardening to our homes and to our community spaces, like churches and whatnot, where it's highly accessible and folks are able to kind of craft what they want to do for themselves. Physical activity, thinking about that social determinant work, we had opportunity to really bring the physicality to folks in terms of walking, biking, and yoga, Zumba, things like that, specifically for our senior populations, really so that folks are able to engage and engage and activate in their own way, right? So like a lot of times either we're fearful of like diving into something, or we're like, I'm too old to do that. And we found some ways by talking to each other and really seeing what folks want, of modeling some behaviors that allow everybody to participate, become active, become mobile, and create the community that they really want to live and see. Encompassing all of that is really a social connection, we think. Niagara Falls, again, is a small city, and I think really eclipsed by its sister city, Buffalo, and those beyond it. And folks may think that a lot of the things that are happening outside of it don't occur here. They're much more visible and sometimes at a larger scale because of our low population. So when I talk about poverty and food access and just seeing a loss of hope, it's really visible. Folks don't know each other when you think that they would. So if you see, right, you're looking at the screen. So I have a mural behind me. And this mural is here located in our office. It's on Pine Avenue. It's called The Nest. And it's really indicative of how, if you ask someone where they lived, it describes the sections of the city that folks would point out to you. So, you know, Highland Avenue, Buffalo Avenue, LaSalle, DeVoe, these are all separate pockets that all are thriving in different ways. And that's not really beneficial to creating a healthy community if you're looking at it in a holistic type of way. One shouldn't have resources and the other should not. So we really work to help folks, one, identify who's in your community, figure, you know, one, starting with a small conversation, but figuring out in what ways can we begin to help heal collectively to bring forth, you know, those positive actions that create the best places for us to, you know, thrive and eat and play. I would say that over the past couple of years, specifically, right, as COVID is involved. So we had just opened this office that we're in March of 2020, and literally 10 days later, there was a shutdown of the world. And we're like, well, what do we do? What do we do for folks? Like that doesn't mean that people don't now not want to get healthy or be where they don't not want to be physically active. How do we continue to connect and push forward some of these positive behaviors? Through modeling some things from one of our family conveners, Leah Russell down in Syracuse. They have something called kitchen table talks. We call them community conversations, but it gave us opportunity to meet those that would in person, but on Zoom, really to connect with folks and see what resources they were lacking and how we could best connect them and continue to push forward in a positive way. Allowed us to hold some book clubs, right? To talk about the racial injustices that were happening and see where we differed and what things that maybe we could do together to bring forward some positivity back into our city. It allowed for greater collaboration, which is something that I think small organizations like ours really thrives on, but some larger don't really see the benefit of, right? Sharing the kudos sometimes allows for others to miss out on resources. We were able to partner with over 30 organizations, both locally here in Niagara Falls and upwards to the state to start with dissemination of PPE, testing when they became available, sanitizer, food, which became like gold, right? Because people were without access to either stores or the farmers markets that they were getting to. So we were able to connect things such as that, medicine, medical care, insurance. It opened up the door for us to still be able to serve and create some sort of positivity when everything looked like just despair, right? And on the back end of that, all of that good work that I believe it was done and it's still happening, we've now encountered, a mass shooting 10 minutes from here. We have encountered just a blizzard a few weeks back, for those that don't know, that really took the lives of many a community member. So we now have opportunity, I think, to lean in on some of these things that are happening to continue and push forward conversations, but look for ways to help prepare one another for being an asset to our neighbors. I always say I'm only as healthy as my neighbor is. And if I don't know who my neighbor is, I'm living probably in a sick place, right? So we have opportunity to really reach out our hands, reach out our resources, which for me, relationships are probably the most critical, and really help build bridges for people where there are none. I will say that this was made possible really through the funding that we received through the New York State Health Foundation. We consistently had super program officers that really worked with us on ideas that most would be like, what's that? We can't quantify that. I don't know what that is. We can't do it. Let's rework it. They're like, okay, well, let's see, right? Because everybody engages in a different way. And they gave us opportunity to really push the envelope and be innovative in terms of strategies to help connect this community, right? Because what we do here may not work for yours. So yeah, I am thankful we had opportunity to get together. I'm thankful to the relationships I think that we have built, not just with the foundation, but with some of our community conveners, which is probably more of the one of the best resources, right? To be able to reach across these clotheslines and get assistance or lend assistance when there is necessary. And that may just be a conversation to help think through what a project may look like and how to help it come to fruition. So, and I would be remiss, Phil and Healthy Places by Design, wonderful. Thank you so much for really, and staying connected, because it wasn't like, here's a one-off, you guys go ahead, here's the work, the money's done, thanks for the report, see you later. There has been some consistent follow-up. We don't, not to kick them out the nest. We're still we're still here and being supported. And so that's really all I have. And I thank you all for listening and joining with us today, really to see what some of this healthy community work has led to. And I will get dropped for us our website. Maybe you can look at some of the projects and whatnot that we were able to do throughout the past couple of years. And thank you again.
Thank you, Brian. That couldn't have been a better segue for Phil. I don't have anything to say. I'm just going to turn it over to Phil to introduce yourself and give a little more context into your role and contribution to the Healthy Neighborhoods Initiative.
Thank you, Bronwyn. Can you see my slide, Bronwyn? And you hear me okay? Okay, great. Well, hello, everyone. But first, Brian, thank you so much for starting us off with your story in Niagara Falls, and for your friendship, and for being such a great source of inspiration and wisdom. And I want to pause on that last point you made about connecting with and learning with and from your peers, and know that you were also a mentor to folks from Syracuse and Clinton County and the Lower East Side and the other organizations that we're doing this work alongside. So thanks so much, Brian, for getting us started with your perspective. As Bronwyn mentioned, I'm with Healthy Places by Design. I'm a senior project director, and we provided one-on-one technical assistance and coaching for the 6 community conveners, in addition to the other 3 conveners that were funded and working out of the Bronx. My colleagues, Casey Allred, Joanne, and I also coordinated the Healthy Neighborhoods Learning Collaborative, which was in place to help build capacity among the local organizers, and not just folks like Brian, but Brian also had partners with him, people who might have been working for other institutions, or in some cases, their only connection were as community residents and community leaders. For part of this grant period, the Learning Collaborative, again, included the 3 additional South Bronx sites, and we had a tremendous partnership with the team from the New York Community Trust, and we learned much from them and their contribution as well. This image on the left shows a traditional hub and spoke approach to capacity building, where support for grantees is given by a single technical assistance provider, or maybe even a technical assistance team. I would say that in this case, our technical assistance team was our organization and Bronwyn and Newper. I get to give a shout out to Newper, and as well as Irfan and Barbara from the New York Community Trust. So we really did link arms on that. And at times, Carolyn and Beth and their team, New York at NYU, gave us input, and we involved them in the content of the learning. Generally, in this model on the left, the content flows out from the hub to those working in the communities, and the relationships are mostly built with the TA provider or providers. For the Healthy Neighborhoods Initiative, though, we applied not just this, but we broadened the approach with the hub and spoke. The way we went about it is that we work closely with the New York Health, New York Community Trust, the conveners themselves, to design content sessions and workshops and meetings around specific topics, pulling in resource people as speakers and trainers when needed. For the Learning Collaborative, again, we broaden the approach to the image on the right to nurture learning relationships among the conveners. This network approach encourages the flow of knowledge in many directions. So peers are sharing ideas, thinking through challenges, offering each other support and mentoring. Brian, as always, when you talk, I'm writing I'm writing quotes down. And one that you said that sounds so good and apt here is that you brought learning strategies from other cities to make them your own. That's really the point, that there are promising practices, but ultimately it's the best practice when it works and is adapted in your community. So those are some things that I wanted to share about conceptually what was our approach to the learning. I see Brian smiling because, and Bronwyn's in this photo too, maybe others. For the Learning Collaborative gatherings, the conveners took turns co-hosting these events. This photo was from one of our quarterly learning meetings in person, when we could do that, when it was safe to do that, in front of the Niagara River, right above the falls. In each case, we learned experientially by walking through host neighborhoods, which we did in Niagara Falls and other communities. We saw their projects. We met some of Brian's partners and residents who were working in the trenches. In between the in-person meetings, and especially when the pandemic hit, we held regular Zoom sessions that were centered on what it takes to create healthier neighborhoods. The conveners presented to each other about the work. So as opposed to the hub and spoke, Brian, Leah, others were actually the centers of this learning and for a give and take. They spoke candidly about their challenges and accomplishments, and again, the promising practices that they developed and may have discovered from some other initiative. To help decide our agendas, we surveyed community coordinators about the topics and the ways that they felt most comfortable learning. And at the end of every meeting, we made it a practice to get real-time feedback using a simple plus delta exercise. Remember flip charts and markers, Sharpies? That's how we conducted our fancy evaluation on the back end. We created spaces for conveners to challenge their own thinking, to propose new ways of moving forward, test ideas off each other, consult with their peers during that process. The topics, again, were consistently framed around systems change. This is back to Bronwyn's point about place-based strategies. We were looking upward constantly about what are the systems in place that are making people unhealthy and those that can make them healthier. Other common topics were equitable access to food, activating public spaces, as Brian mentioned, community engagement, and obviously collaboration. I'm going to close here with some quotes and let you know that please check out our blog series. This is at Healthy Places by Design's website. If you haven't seen it, these came out in the fall, but Stephanie, if you wouldn't mind, go ahead and dropping this in the chat, I'd appreciate that. Rather than creating a summary report just of our lessons and findings from Healthy Places by Design, we interviewed the conveners to highlight their insights about the initiative. And Brian led us off. I believe he was our first one. And if you want to know more about what was on his mind at the time, please read these. Again, you can still find them in the blog section of our website from January through May of 2022. I have a couple of quotes that I think are really important, since we only have Brian with us in real life. I did want to lift up what some of the others said, and they're loosely categorized by similar themes. Leah Russell at the Center for Court Innovation in Syracuse told us it was life-changing professionally. The project reframed the way I see my work as an agent of systems change, period. We began to view our justice system work through the lens of public health and explore the intersections between public safety, justice system involvement, community health, and wellness. Rather than being solidly in one field or the other, we should be working at that intersection. It's been a real paradigm shift. And I think that goes to the heart of why the foundation at the beginning referred to, and these folks embodied being conveners. So really appreciated how Leah put it. Mandy Snee, a director at for prevention in the Clinton County Health Department, said this about their own staff and their influence on others. It changed how we recruit and what we're looking for in people. We saw an impact on our team's confidence within the health department. And when we can empower our partners with the skills we have or take on this work themselves, it means we can revisit other unaddressed public health problems. And I think Mandy is talking about what's the imprint left may not be as direct by what the health department staff have done in the community. It's their influence on other organizations that can go on and become adjuncts or extensions of the public health staff. The biggest hurdles faced by conveners and their partners were generally competing priorities. So by far the most significant competing priority was COVID-19, which put many projects on hold. Coordinators were redeployed for pandemic response. In particular, the public health departments. I mean, Brian's organization, all of them, even the nonprofits, were scrambling to to find PPE and to distribute food bags to people's homes. But in the cases of the Department of Health and Mental Hygiene in East Harlem and the Clinton County Health Department, people were literally redeployed overnight. And so they were trying to keep all of these things happening at the same time. So Arlen Zamula in East Harlem shared this: COVID-19 hurt us in every aspect. 2 team members had to be pulled off the Healthy Neighborhoods work to respond to the crisis. COVID turned out as an extreme example of trying to balance the needs of the community, the funder, and our own group, a government organization. More broadly, being a collaborator, Linda Bryant from Project Eats in Brownsville said, sometimes it's necessary to have uncomfortable conversations with partners. Competitiveness is unproductive and corrupts what we're all trying to achieve. It's important that we work that out. And then last set of quotes for you. The conveners shared their thoughts about working together as peers and mentors, as Brian has, from University Settlement and Lower East Side, who joined the initiative about halfway through. So they had to do a lot of catch up. Michelle Rodriguez and Jennifer Vallone said, listening to our colleagues from other communities shaped the work we did. We distributed health bucks to participants to purchase more fruits and vegetables, and we tried to improve what the local food pantry offered. The foundation brought a remarkable group of people together for learning. And similarly from Mandy, again in Clinton County, even within our department, our work is often misunderstood. So whenever we got together in peer learning sessions or even virtual calls, it was just so motivating and reassuring to see and hear about what the work that other coordinators were doing that was similar to ours. It meant that we weren't just these misfits. And I think that within a public health department, doing this kind of really upstream work may feel isolating to others who are working on, say, restaurant inspections or other in-WIC clinics. And then finally, this quote from Leah I want to hold up about the lasting impact of the project and really the resilience of the community is when the pandemic hit, we learned we were a well-organized community. The social infrastructure is there to absorb the blows that come our way. We still have a long way to go, but we're able to increase residents' capacity. They now have the knowledge and confidence to speak up and to get paid work too. So again, please visit these conversations at our blog to hear more about their accomplishments, their pain points, and really recommendations for funders and other change agents. At this point, I want to thank you for inviting me on, and I'll pass the baton to our friends, Beth and Carolyn.
Thanks a lot. Carol and I are going to do this presentation together. I'm going to sort of take off and she will add in some extra commentary. I want to say that the 2 presentations that precede ours, it's just an amazing recognition of how the key themes of this initiative came through so clearly in both Brian and Phil's comments, and we are going to simply echo, I think, what they've said or kind of bring it together a little bit in terms of speaking to what we've learned from our opportunity to work so closely and extensively with all of the sites, the 6 sites funded by New York Health, but also the other 3 sites in the Bronx funded by the Community Trust. Brian, each of your comments, just they sound like perfect ways of echoing what we think are some of the most important learnings of this initiative. I should say, we're going to make a few key points here. Our report is long and dense. We learned so much, and we feel like we had so much to give back to the field as a result of this opportunity. But we'll just highlight a few things. And I should say that we approach this as looking at a lot at the literature. What do we already know about place-based work, these efforts to change communities in such an important and fundamental way? And there were things about this initiative that were different, that were experimental, that were really sort of an opportunity to see things from a new perspective. So we're going to highlight, I think, some of the ways in which the learnings of this initiative may be different from what we've heard elsewhere. So first, we wanted to talk about the flexibility that both foundations offered in regard to this initiative. They provided the goals. You heard them. They're about providing access to healthy and affordable food and safe places for physical activity and exercise. That said, they provided enormous latitude and flexibility in determining the boundaries of the target communities, something quite fundamental, looking at the specific priorities, what was appropriate to that place, and the means for achieving them. You've already heard the importance of the collaboration across sites. Having two funders working together extended those opportunities, right? Instead of 6 sites, now there were 9. Brian already noted this, but the foundation staff really took time to listen and learn. And because they were so close to the sites and hearing their needs, they were allowed to be flexible in a really thoughtful way, not requiring something just because it should be required, but really hearing how it needed to be adapted to the needs of the site. As I already mentioned, they allowed the very definition of a neighborhood to be flexible. And we found that to be really an exciting and interesting and challenging aspect of this work. A lot of experimentation, a lot of tailoring to local needs, a lot of responsiveness. And as Brian already said, but we heard repeatedly from the conveners, this degree of flexibility and responsiveness was of great value. It allowed the work to be done in a way that it would not have been should it had been so strictly formalized in a sense. We did see one downside in all this flexibility, though. It left some of the grantees feeling a little uncertain and anxious about what the expectations were in this project. And so that is a little bit of a trade-off, that anxiety, particularly at the beginning, of what were they being asked to do if they were being given all of this flexibility, came up over again. Carolyn, anything else on the flexibility that I'm missing here?
I would just add to the last point. There was often a sense of, are we doing the right thing? And they sometimes turn to us as the evaluators. Are we doing the right thing? Are we on track? And so I think it's an inherent tension, right? You give a lot of flexibility, you give a lot of latitude, but then some people sometimes feel a little uneasy with all that freedom, so to speak. But I think ultimately it worked out well, and I think most of the grantees would say so as well.
Yeah, and I think the convenings that Phil described helped sometimes in that regard. Sometimes it opens it up even further, made people anxious, but I think mostly it gave them an opportunity to feel more confident in their experimentation. It's a challenge there.
And I would also add, just extending the point about the difference in the neighborhood. You know, this was called the Healthy Neighborhoods Initiative, but neighborhood ranged from the entire county of Clinton County, which is a very large county with very few people in it, to East Harlem. And so you don't typically see that in a place-based initiative. And I just wanted to underscore that point, how different that was, and how that allowed such variability to flourish, and for us to all learn from, and for people to learn from one another.
When we kind of scoured the literature about place-based work, and it really was a really different and exciting feature of this effort to have such different contexts. As Carolyn said, I mean, we had neighborhoods that were defined solely by a group of public housing projects, you know, a certain kind of community like that. And then Brian, you did such a nice job of describing, you know, your community, but areas in the upstate region, small to mid-sized cities, one rural county, where rental homes, a lot of emptiness, right? A lot of depopulation, food deserts, very different contexts. What was interesting in some ways is that even though these contexts led to different approaches and priorities, there were some threads that went through, and we, I think, found that interesting. In particular, the needs and concerns about safety, safe places, safe passages to foods, opportunities and things like that came up regardless, right? And so this need to think about safety in these communities as being a critical feature of being able to facilitate food access and activity access was clear regardless.
And I would add to that that was not upfront expected. And it speaks also to the flexibility that the foundations at first said, what, safety? But adapted. Okay, that's what it takes. That's what it's going to take to get to the point where they can think about access to food or access to physical spaces for activity. So those 2 points commingle there.
Transportation issues came up in both urban and less urban settings. Do you bring food to the people? Do you bring people to the food? Do you same thing with exercise opportunities? So we saw a lot about transportation and the making use of existing government programs. So Bronwyn started out by talking about leveraging additional funds, but also there was a kind of a leveraging of available programs, particularly health bucks and things of that nature, where this convening, this organizing allowed for the leveraging of those things. The lead agencies, as you've already heard, were highly varied, much more so than in other initiatives where typically everybody would be from a health department or everybody would be from a settlement house. This included all of those and more, health plans and things of that nature. Given that this was ultimately a health initiative with its focus on diet and exercise, in a sense, having a health related organization as the convener, or at least as a strong partner, proved to be important in keeping those health goals on the table. Those lead agencies that had a good history of collaboration and partnering, they were able to get going much more easily. They already had those neighborhood, those community connections. Similarly or relatedly, the issue of local respect, very, very important. And those organizations that were not well respected in their communities really struggled. We were surprised to realize or to note or to learn physical location in the target neighborhood was not actually necessary for success if there were strong ties to that neighborhood already. Deep respect, strong ties, didn't have to be in the community, but it had to have that connection. You've heard already about this issue of COVID, both as Phil mentioned, as a huge challenge to the work, our work as well, but to the work in the communities, but also as the quote from Leah Russell pointed out, this effort really did allow for a very robust response to the pandemic and the shutdown. Having these organizations, these relationships, these partnerships, having some group of people who had an ear to the ground allowed these communities to respond to the challenges of COVID in some very important ways. Brian talked about bringing people together on Zoom for discussions. We had one site that had dance lessons on Zoom. I mean, there were a lot of really interesting and important ways in which the collaboration helped people work together really effectively. Although, again, in these communities, the technology divide was very evident. And so there was a very difficult period at the beginning of getting people up to speed and ready to work in that way. And then I guess, Carolyn, I feel bad. I feel like our last point is a little bit of a downer. And so maybe we can turn it around somehow. But we wanted to stress that this is not new to this work, but I think it's just endlessly important. Turnover is inevitable and challenging. And here we refer both to staff turnover, but perhaps even more importantly, to turnover in the convening agency. And so when you make this commitment, as New York Health did, to work with the community over time, the question of how you sort of build in the capacity to ride those kind of changes, that kind of turnover, I think becomes very important. We saw of great difficulty when conveners came late to the game because they were replacing others. Staff members also had to do that well and plan for it. Hard. I mean, this commitment to community was so strong, but sustaining it over time was sometimes a source of challenge. I'm mindful that we want to move on to questions, but Carolyn, what did I miss on that not so pleasant note?
I was following along on our points and I think you hit them all. So, but we welcome questions and further discussion on any of these points.
And even beyond today, I mean, you have access to a report. We go into some other things in more depth. We're happy to hear from anyone who would like more information.
Thank you, Beth and Carolyn. I do want to invite the audience to start dropping questions into the chat. I'll do my best to facilitate and get to everyone. I also know there are a few other past conveners who are on the webinar, both from the Bronx and from other neighborhoods. So if you would feel like sharing anything that would be good or bad, pluses or minuses, as Phil would say, that would be great. I did want to follow up with a question for Brian, which is, you know, we did try to provide some sustainability funding and but that ended. You know, it's 2023 now. So I just wanted to check in and say, you know, what does Create a Healthier Niagara Falls look like now? How is it going?
So I think it was Beth talking about that turnover, right? So COVID did a few things for us. It really, one, slowed down our opportunity with our volunteer base and had many of us really thinking about, you know, family. That said, we have, you know, a remote member who's moved out of the country. One of our other leaders who's on her way to possibly retiring. You know how Evelyn is. She doesn't know today or tomorrow. And then we kind of lost someone in the midst. So, you know, at this point, we are really looking to build our base back up through a lot of the programming that we had going on that stayed consistent, and that was specifically around physical activity, our walking club and walking events, which stayed solid. Our folks that are involved in the Healthy Food, Healthy People and the Niagara Falls Local Food Action Plan. So we are leaning in on those folks in terms of capacity building and some leadership. Sustainability is also providing us with a lot of the technical assistance that was kind of left, not by anyone in particular, but because we couldn't do a lot of things collectively, we needed to lean in on some professional skill sets to help us continue on with messaging and being able to be visible in the community. Like, you know, when you can't just go up to people and have those usual one-on-ones, it was more of the collaborating, passing, handing out, you know, flyers and getting to some of these other resource agencies to really keep the educational pieces going and you know, getting the low-hanging fruits in from that. And I know that would not have occurred without having the opportunity to take advantage of any of the technical assistance. And we've been able to form a few relationships since then. So we're like looking to kind of move into not just having people come in to do things, but maybe having us trained on these things, specifically around like grant writing, grant searching and things like that. So we're not dependent on an outside entity to do any of that. So we're still kicking and we're still fighting, and Niagara Falls is still rising for the best.
Awesome. Okay, I wanted to also check in with Phil and Beth and Carolyn and say, you know, all of you, especially Phil, does similar work, providing technical assistance and evaluation nationally at the national level to other groups in other regions of the country. So, you know, what did you expect from this initiative? What did you not expect? Were there any surprises? Again, each region is unique and it's, you know, has their own things going, but I'm just wondering, you know, if you can compare and contrast. Phil, I'm gonna call on you first.
Yeah, great question, Bronwyn. I guess, as you said, we've had other engagements, say at the national level or within a state like this one, sometimes just with one community and funder, and we expected to see some very impressive work. You know, you described this as a place-based effort. I would just extend that to this is a place-based health equity initiative. You know, I think you could have substituted in some other issue like housing or criminal justice in place of food access and safe places for physical activities. You know, the approaches are foundational. The community organizing, the community engagement, which you know, Brian and his team really did as a as a model, the way they engaged it and embodied it so much that 4 residents were essentially co-chairs of this effort and leading the work. One thing that's a little bit novel about this is most place-based health equity initiatives don't last 5 years. And I think what we hope is that any initiative will have real-time outcomes within the project period, because the funder is making investments and the community is making its investments, and we are helping, and evaluators are evaluating it. But ultimately, it's not just for this moment that impact is made. It's what happens next. What is the community building in terms of its own capacity? And what's unique about this process is we could see, after some capacity and experience had been built, from Leah's quote, that they were ready. They were more ready when COVID came around, because they had already done a lot of community organizing. So yes, it is about the food access and physical activity access here and now and within this 5-year period, but that community is more resilient, more ready in year 6 that's not funded, and 7, and what's the next challenge that's coming around the community. So we're really building for the long term. Those things are hard to measure, as sure Beth and Carolyn can attest. So I guess I would say that what was completely unexpected was a pandemic that went through every community. And fortunately, as learning coordinators, we had just turned to Zoom about 6 months or a year before the pandemic hit. Everyone and their grandmother had a Zoom account after the pandemic hit, and we all became comfortable with it, which made our work better, or our work easier. But I think that we fortunately could stay in touch regularly for peer conversations through Zoom. So that helped us a little bit.
I had previously done similar work, and even larger initiative, but that was whole cities versus neighborhoods. So it's kind of interesting to think about what was similar or different, and what I was supposed. I will say, in both those initiatives, that one and this one, I'm always surprised at how important the cross-site visits are to the conveners and the other participants. The notion that you put people on a bus and you bring them around, and you make stops, you look at it, and I'm always thinking, like, really, is this going to really work? But it works remarkably well. So that always, it wasn't new to me, and yet it was still surprising to me how much the actual physical, visit went a step beyond even the convening learning sessions. And of course that couldn't continue with COVID. But I think that is an important piece. There's something about visiting and seeing and talking in someone's kind of real space that seems very powerful for this place-based work, as an opportunity to see differences and find similarities. When you work at a city level, you have more opportunity to create policy change, but you're not as close to the people on the ground. And this was kind of the flip of that, right? And there was some incredible advantages of the proximity, the closeness, the knowledge about really getting at what people wanted, needed, were willing to engage in, and so forth. And that was real value here. It left it a little more distant from the kind of policy making work that might benefit these communities and others. And I think the work going forward will be thinking about how to bridge that, right? A little bit about how do we get everything we can from the value of working in neighborhoods, in communities, and also allow them, as much access as possible to making systems change at a higher, at a policy level. Carolyn, what did you learn?
Well, I guess I have to admit that I was a little surprised that it all didn't fall apart. That between substantial turnover in various ways and then the pandemic, how strong really the commitment was, both from the foundation side, but really from the sites, and to continue the work and to figure out a way, and they all did. you know, and all the way to the end, things were still happening and growing and new stuff. And I was frankly a little surprised by that perseverance to the end. So kudos to all.
Can I just add one little anecdote that I think, and it goes with Brian's comments, but I recently had a conversation with a colleague, another evaluator researcher here at NYU, who was talking about starting some work with one of the conveners, won't say which one, and was talking about how amazingly committed this convener was to healthy food access. This was a convener that had no experience with that area at all prior to this initiative, to the Healthy Neighborhoods Initiative. And so I felt like, wow, something was really left behind here that will continue to have, you know, real benefit, because she thought they would always have been committed to something like this. And it was like, no, it was really as a result of this work. So it was a very rewarding moment.
Thank you, Beth and Carolyn. There is still time for questions, but there are a lot of shout outs in the chat, which I appreciate, including Patrick dropped a link to the South Bronx and the evaluation of the South Bronx. So please check that out as well. I think, you know, if we don't have any questions, we can close this out. But I know, as Beth said, everyone is available for chats after this. The webinar will be made available in the next day or so, and all of the links to the reports and the case studies and the blogs are on our website. I want to thank our guests for being here today. I always learn so much from all of you. So I'm very grateful. Thank you. And thank you all for joining in and being a part of this and sticking with us through the hour. I hope you all enjoy the rest of your day, and thank you so much.